We haven't crossed to the WHO in some time. I heard from the WHO, but there is indeed a briefing at this hour. Let's take you there to take a listen.
Emergencies and Maria von Kerkhove, COVID-19 technical lead. Now I would like to hand over to Dr. Tedros for his opening remarks. Over to you, DG.
Thank you, Fadila. Good morning, good afternoon, and good evening. Since the beginning of the pandemic, WHO has emphasized the vital importance of testing as part of a comprehensive strategy to control COVID-19 transmission. Within 2 weeks of WHO learning of the first case of the novel coronavirus, China shared the genetic sequences with WHO and the wider world. Working with our partner lab in Germany, Charité University, we then published the first virus. China shared the genetic sequences with WHO and the wider world. Working with our partner lab in Germany, Charité University, we then published the first instructions on how to build a validated PCR test for COVID-19. By the third week of January, WHO had contracted the manufacturer of PCR reagents for COVID-19. And by the late January, WHO began shipping PCR tests to over 150 labs around the world, enabling countries to identify and trace the virus. At the same time, we began working with partners to develop simpler, faster tests for use anywhere around the world to diagnose COVID-19. Last week, we reached an important milestone in which WHO issued the first emergency use listing for a quality antigen-based rapid diagnostic test, and we expect other rapid tests to follow. Today, I have good news. I'm pleased to announce that thanks to an agreement between WHO and partners here today and others, a substantial proportion of these rapid tests, 120 million, will be made available to low and middle-income countries. These tests provide reliable results in approximately 15 to 30 minutes, rather than hours or days at a lower price with less sophisticated equipment. This will enable the expansion of testing, particularly in hard-to-reach areas that do not have lab facilities or enough trained health workers to carry out PCR tests. This is a vital addition to their testing capacity and especially important in areas of high transmission. Volume guarantee agreements have been developed between two manufacturers and the Bill and Melinda Gates Foundation, which will make 120 million of these new, highly portable and easy-to-use rapid diagnostic tests available over a period of 6 months. Currently, they are priced at a maximum of $5 per unit. These are already substantially cheaper than PCR tests, and we expect the price to come down. The quicker COVID-19 can be diagnosed, the quicker action can be taken to treat and isolate those with the virus and trace their contacts. We have an agreement, we have seed funding, and now we need the full amount of funds to buy these tests. Over the weekend, my friend Boris Johnson, the Prime Minister of the United Kingdom, announced new funding for both WHO and COVAX, which is the vaccine's arm of the ACT Accelerator. Together, the world has to raise an additional $35 billion for the ACT Accelerator. But this represents a great deal for countries in the context of the trillions of dollars they're currently spending on stimulus to keep economies afloat. If we act together, we will win together. To tell us more about today's breakthrough in diagnostics, I will now hand over to my sister, Dr. Katarina Bem, who is the CEO of FIND. Katarina.
Today, as the CEO of FIND, but also as the co-convener of the ACT Accelerator Diagnostics pillar, together with the Global Fund. As you've said, today is a major milestone, not just for the ACT Accelerator, but we believe for the global response to COVID-19. Testing is at the forefront of the response. It is our first line of defense, critical for countries to track, trace, and isolate, to stop the spread of the virus and to ensure that we are not flying blind. The pandemic has exposed weaknesses in testing in health systems of all countries across the world. In low and middle income countries, however, it's vital that testing levels are dramatically increased with great urgency. There are over 30 partners in the ACT Accelerator diagnostic pillar, and the package of interventions that we're sharing with you today is testament to the strength and breadth of the powers of our partnership. As Tedros said, we are announcing a comprehensive package to make available 120 million affordable, high-quality COVID-19 tests, antigen rapid diagnostic tests in low-middle-income countries. Let me now walk you through the four main components of this package. First of all, innovative new tests. Following the WHO policy guidance on antigen RDTs on the 11th of September, we now have two high-quality tests, which are the first in a series that are being developed and assessed by WHO for emergency use listing. These tests provide reliable results in just 15 minutes rather than hours or days and will enable expansion of testing, particularly in countries that do not have extensive laboratory capacity or trained health workers to implement molecular or PCR-based tests. So these antigen rapid diagnostic tests are a critical complement to these molecular and lab-based tools. Second, volume guarantees. Agreements have been signed between the Bill and Melinda Gates Foundation and two rapid diagnostic tests producers, Abbott and SD Biosensor, to make 120 million tests available at $5 for low-middle income countries over a period of 6 months. A $50 million procurement fund is the third component of the package, and that will enable to rapidly scale up these tests. The Global Fund has committed to an initial $50 million from its COVID-19 response mechanism to enable countries to procure at least 10 million tests. The first orders are expected already to be placed this week. And last not least, the fourth component, an implementation, research and rollout component. Together with WHO, we at FIND are working to understand how these tests will best be used in countries and how they optimally fit into health systems. We'll provide catalytic volumes of tests to enable countries to conduct implementation research. UNITAID and Africa CDC will be rolling out these tests in up to 20 countries in Africa, starting in October. Their work is being supported by organizations including CHAI, the Clinton Health Access Initiative, the African Society for Laboratory Medicine, ASLM, and local organizations. This complements the African Union's partnership to accelerate COVID-19 testing, Pac Initiative. So this comprehensive end-to-end package of interventions has been put together with a speed that none of us here today have ever seen before. And it's really a testament to the power of the partnership. With this package, and thanks to financial support of several countries, the ACT Accelerator partners have secured much needed tools for low-middle income countries to dramatically increase COVID-19 testing. However, as Dr. Tedros said, and while we've made great progress, challenges, of course, remain. To reach all those who need testing and to bring test prices down, we urgently need to fill substantial funding gaps that remain. Today, the ACT Accelerator Diagnostic Partnership still needs 1.7 billion before the end of the year to deliver what is needed to ensure everyone who needs a test gets one. Thank you very much.
Thank you, Katarina, for those inspiring words. Now I hand over the floor to my brother Peter Sands, CEO of Global Fund.
Thank you, Dr. Tedros, and I'm speaking here not just as the Executive Director of the Global Fund, but as the other co-convener of the ACT Accelerator Diagnostics Pillar alongside Katarina. Being able to deploy quality antigen RDTs, rapid diagnostic tests, will be a significant step forward in enabling countries to contain and combat COVID-19. They're not a silver bullet, but hugely valuable as a complement to PCR tests, since although they're a bit less accurate, they're much faster, cheaper, and don't require a lab. The significance of today's announcement is the entire package. The partners have come together to secure volume for low and middle income countries, to provide funding, and to provide technical support on the ground to expedite rollout and ensure the most effective usage. This will enable low and middle income countries to begin to close the dramatic gap in testing between rich and poor countries, and is thus a big step towards more equitable allocation of diagnostics. Right now, high-income countries are conducting 292 tests per day per 100,000 people. For upper middle-income countries, that number is 77. For lower middle-income countries, 61. And for low-income countries, 14. There are still challenges. The guarantee for 120 million tests, and I'm sure you can do the maths, will require $600 million, which we don't yet have. And even 120 million tests over 6 months, while a massive increase over what has been available so far, represents a fraction of what is really required. If low and middle income countries were testing at the rate high income countries are testing right now, 120 million tests would be enough for less than 2 weeks. Moreover, with the emergence of these antigen RDTs, we are likely to see testing rates increase significantly in countries at every income level. The Global Fund anticipates using at least 50 million from our COVID-19 response mechanism to support countries in procuring these tests, as well as continuing to support countries in procuring PCR tests. We anticipate initiating the first orders this week. But our ability to continue to fund countries in purchasing these tests will be a function of the continued support we get from donors for our COVID-19 response. But the volume guarantees are not tied to any particular purchasing mechanism or source of funds. So we will be working with our partners in the Diagnostics Consortium to make access to these tests as easy as possible. For example, we'll let countries use our procurement platform to buy these tests where they have funding from other sources. It was Dr. Tedros who said early on in the crisis, test, test, test. Experience since then has, if anything, reinforced the central importance of testing to fight COVID-19. With today's announcement, we hope to give low and middle-income countries new testing tools that are an important step in enabling them to be even more effective in containing and combating the pandemic, saving lives, protecting communities, and enabling economies to restart.
Yeah, thank you. Okay, thank you, Peter. I will now hand over to my brother, Robert Matiru, from UNITAID. Robert.
Thank you, Dr. Tedros. Thank you, partners. As a development financing agency that brings innovation to the forefront of improving and preserving human life, UNITAID is very pleased to be part of this global collaboration that's going to bring simpler, more effective, and lower-priced point-of-care antigen tests to the global fight against COVID-19. As you heard from Peter, the testing gap in low- and middle-income countries compared to high-income countries is staggering. It's 10 times less in low- and middle-income countries. Of course, having a test that can be simply used, that's high performing and that's affordable, can be a game changer in accelerating the number of tests that can be performed and also closing this gap. In support of the market and country preparedness work streams of the ACT Accelerator, UNITAID and the Africa CDC will combine resources to initiate the rollout of these tests in up to 20 countries, as you heard from Katerina, starting in a couple of weeks. This multi-million-dollar intervention is designed to engage multiple partners active in the COVID-19 response on the continent, such as the Clinton Health Access Initiative, the Africa Society for Laboratory Medicine, and crucially, local partners, those who are dedicated to building the capacity of community-based and frontline healthcare workers. You've heard about the advantages of antigen RDT, so I won't belabor that point. But what I will say is that this specific country-facing intervention will support activities such as accurate forecasting, so we know how to determine how many tests should be ordered and deployed, registration of these tests, collaborating with regulatory authorities to ensure that they can be quickly approved for importation, developing innovative delivery models in all settings in these countries. Training test administrators will be key, as is safety monitoring. Developing data systems to capture test outcomes, planning for community mobilization, as well as methods to monitor product uptake. These tests, as you heard, can substantially reduce the transmission of COVID-19, which, as we know, will have a major public health impact in terms of morbidity and mortality. But also the significant economic benefits will be absolutely key, allowing countries to keep the epidemic curve flat and also to keep their economies open. So we're very happy to be able to contribute to the objectives of the ACTA Diagnostics workstream, to collaborate with all the partners at this table and those that aren't, to make this a reality. Thank you very much.
Thank you. Thank you, Robert. And finally, I will now hand the floor to my brother, John Kangasong, who is the director of the Africa CDC. John, you have the floor.
Thank you, Dr. Tedros, and greetings from Addis Ababa. And I see all the colleagues and friends that we've worked over the years to strengthen health systems and expand diagnostics. So it's truly a pleasure to join you. For us, representing Africa CDC, today represents and symbolizes the whole discussion around cooperation, coordination, and collaboration in the spirit of solidarity as we fight this terrible pandemic. This is what we have been calling for as Africa, to support our efforts to scale up testing. We've always recognized that the pathway towards enabling us to achieve a testing goal is inevitably through a test that is affordable, is easy to use, is scalable, and is reliable. And I believe that the launch of this initiative around the antigen testing represents just that. I would like to sincerely thank the partners we've worked with, are going to work on this initiative, FINE and UNITAID. As you are all aware, the continent, as we speak, has tested or has conducted just under 15 million tests. And it's not because the continent doesn't know how to test. It is essentially because the current tools that we have do not enable us to fulfill those four criteria. That is easy to use, affordable, scalable, and reliable. We have two initiatives that will immediately benefit from this announcement. First of all is the Pac Initiative, as Catherine mentioned, the partnership to accelerate COVID testing, which is underpinned by the need to test, to trace, and to treat. We've also just announced, as the African Union level, a campaign against COVID-19, which is really whose goal is to expand testing to ensure that we ease the lockdown of our economies in a very systematic and safe manner. So today's announcement, we believe, will be transformative in enabling us to reach these big initiatives that the continent is driving through the African Union. So I thank you for your partnership and cooperation, and look forward to the implementation in the field.
Thank you so much, John. Hamasagnalo. So now, Fadila, back to you for the Q&A.
Thank you, Dr. Tedros, and to our speakers. We will now open the floor to questions from members of the media. I remind you that you need to raise your hand and use the raise your hand icon in order to get in the queue to ask your questions, and also reminding you that this briefing is translated into the 6 UN official languages plus Portuguese and Hindi. Now I would like to give the floor to Lara Pinheiro from Globo, Brazil. Lara, can you hear me?
Yes, can you hear me?
Yeah, very well. Please ask your question. Go ahead.
I would like to ask Dr. Nkengasong, I hope I pronounced that right, on his current view of the COVID-19 situation in Africa as a whole. What factors have contributed, for example, to the continent having fewer cases than others, such as South America? And I would love it